Okay, hi guys. Just wondering if you can hear me. Just on you'll end up with this panel, this grey panel over here on the sides, and what you can do with that is either raise a hand, or you can actually put there's a chat box down the bottom. So I'm just wondering if you can actually hear me on any of these ones. You can hear me coming through? All good here, excellent. So there's either the questions one that you can use, or so if you expand all of these dashboards, so we've got an attendees and a polls and a questions, I think. Either questions and chat, I think you've got on yours. Do you? On that grey thing up the top, right in your top left, right-hand corner, what have you got on that? Yeah, okay. No. Cool, excellent, good stuff. Just getting Sarah in the office as well, so you can hear me coming through? Excellent, good to hear. So how is everyone going? I might just unmute you all and you can have a chat if you can actually talk rather than typing stuff in. So I'll just unmute you all at the moment, which may be a disaster. Okay. So you are all unmuted at the moment. You can have a chat. So people
Hey
going
Mo,
well?
how you going?
I'm good. I'm good. How about you?
Yeah, going well, mate.
Excellent. Just trying to get out of slideshow view because the two screens isn't working so well, but oh well.
Oh, there's the raise your hand button.
There's the raise hand button, where you can either type stuff in or you can actually like just raise a hand in through there. And another one, just wondering if you have access to the handouts document. Does that come up on your control panel either?
Yeah, we're getting that with
So
your very creative diagram at the end of it.
you can see the creative diagram. Awesome. That's good to hear. No?
Self-portrait, I'm sure.
Just a sec.
Raise hand. I can't find anywhere I would type anything in either.
Show control. So you got the handout.
Okay.
Sorry about that. So we've got a few people on the line at the moment, so that's good. Everyone else can hear me but didn't type in before. So you do have this this grey control panel, and what you need to do is either it might, so if I put it over here, you might be able to see it better. But if you've got this one here, this hides the control panel, and this actually expands it out so it will look something like this. Mine obviously looks a little bit different because I'm organising it, not as an attendee. But that's how you type in.
Oh, but I don't think we can see your control panel.
You don't think you can see the control panel? If we pop it back over on this screen, does that make it better? Or not really?
No.
No, that's all right. But yeah, and again, if you see this little grey window up in the top right-hand side corner of your one, just click the little right arrow that will say hide or expand the control panel. Okay, we'll just wait a little bit longer and then we'll get started. I got it. Awesome. Good to hear. So how's everyone doing so far? It's all good? Good?
Good.
Excellent. Okay. I think we've got a few people on there. We're starting to get some more people on, which is good.
Hey, Bo, how many are you expecting?
We've got about 20 so far registered, which is good. So hopefully we get at least 15 or so on the line. Cool. So I'll just unmute everyone. Everyone can hear me. Again, for those people that just joined a little bit later, just want you to just pop into that either the chat box or the questions one. Just let me know if you can actually hear me coming through. Awesome, thanks Tom. All good. Can hear, sweet, lovely. So I'm not getting any can't hear, which is great. Okay, so we'll get started because we've got a fair amount of ground to cover on this one. So I'll just pop you back into mute. And if you have any questions, you can either type them in and I'll try and address them, or raise your hand and I'll probably just unmute you and let you ask the question on the line. Okay. So again, if we go back to muting you all, sorry about that, but we start to get feedback. But so Dr. Tan, he developed some of these systems, and what you can actually see with this on the screen is the quote from Dr. Tan that says, Li Gan Jian Yin, which means you stand a pole under the sun and immediately you should see the shadow. And his view is that as soon as the needles go in, you should start to see a result, whatever that result is, but a change in the condition is usually what you're looking for in terms of that. And he went on about this particular quote, and he's even drawn this on his book with the calligraphy of this. But he said that the results of modern practice weren't as effective as has been documented in his historical text, and when he was observed as a practice back in his Taiwan days. So what he wanted to do was trying to see, well, what's the problem? Where are we going wrong? Why aren't we getting these results? So again, went back to the source and looked at these classical texts and developed sort of his version of some of these classical concepts as well, and then put it into a system so that it could be workable. So Dr. Tan's texts, he has 4 of them in acupuncture. They're the strategy, Dr. Tan's strategy of the magical 12, which we're not going to go into too much today. 12 and 12 in acupuncture, 24 more in acupuncture. These were written in the mid-90s with just basically his personal views on the best points that he chose at that time. The vast majority of the information is from this acupuncture 1, 2, 3. And as we can see, these are those of you that can read the characters. This is what that actually says before, with that stand a pole in the sand and immediately you see the shadow. And his big thing is that you should actually see an instant change in the treatments. So I can pretty much tell you just from looking at these points, this patient has back pain. Why? Because basically we can see these points here and here, which will go into why they're for back pain. And he's also then balancing particularly down the lung channel. So he's using the lung channel to balance the bladder channel, but we'll go into that in a little bit. So you're probably asking, what's in it for me? Like, why have I decided to come to this attend? Well, again, I can't answer for you, but what I got out of going to a Dr. Tan seminar was a bit more of an understanding of some of those classical texts and concepts, and also a way of explaining things that I always thought were either experiential or this was just the way it happened. But that was my experience with it. So I hope that I can convey some of those some of that information to you through the next, well, however long this webinar goes for, maybe an hour, maybe a little bit longer. So here's acupuncture 1, 2, 3. What the 1, 2, 3 is the models that we use. So we identify the sick meridians. So his idea of sick is, you know, whatever the problem is in a meridian. So it could be pain, it could be numbness, it could be tingling, it could be a skin problem. Any of these sorts of things are considered to be a sick meridian in this sense. Then we determine a balancing treatment or a treating meridian from the systems, and then we pick points based on step 2. So again, that sounds pretty simple. And his idea is don't skip steps. So always, you know, what's the problem? How do we balance it? And then how do we treat it? So don't necessarily jump straight to the points, because you might miss a step. So we can choose points through a mirror, an image, and the second one is, well, the third one is a bagua, which we're not going to talk about today. It goes a bit more complex than what we're going to talk about today. So his idea is this, that if the pain was on the left-hand side here, well, sorry, that's the right-hand side, to balance it, we'd need to put points on here, or balancing treatments to achieve this balance. If we put points on this side, then we're just going to jack this side down, and, you know, they're going to be stuck on the ground and it's not really going to be balancing. Or this was a quote from Dr. Tan where he said, now, if we're looking at your pain as a light bulb, what idiot puts the light switch next to the light bulb? So the idea of the balancing system is to take effectively find the light switch to turn off the pain, or find the switch to turn off the pain. So again, the information that we're going to talk about today is all about truths and perspectives, and some of them, there's probably no more truths than what you already know. It's just looking at it from a different perspective. So again, this is why I picked this point, this picture. This, you know, the moon actually only looks like it's coming out of the sea from the perspective, but we know that it certainly doesn't come out of the sea from this one. And again, you know, if we're looking at it from a different perspective, this whole picture would look totally different. So our crazy demon here, what this actually means is, again, along those same lines, that if we had someone drilling into, you know, someone's teeth, all of it would be sore. So this is how he looks at the pain or the injuries or anything along those sorts of lines. And finding Ashur points in here is sort of futile because all of it is Ashur. So like his idea is that it's, you know, you find the Ashurs on the balancing meridians, not, you know, where the actual problem is. And then I said, you know, this guy says it best. So this guy is actually, you know, for those of you that don't know Isaac Newton, the clue is the apple, right? Where he said, for every action, there's an equal and opposite reaction. So we've just got to find the equal and opposite reaction that we're aiming for. Okay, so that's the very quick introduction of that. So we'll start to move on to the systems. There's 6 that we're going to cover. The first one, again, funny enough, called System 1, is probably something that you're quite familiar with. It's a 6-divisional partner of a Chinese meridian name sharing. So that's quite a mouthful and could have been worded better. But hand channels treat foot channels treat hand channels, and they're paired from that 6-divisional or name point of view. So Tai yin, lung and spleen paired together, and etc. on that table. So from this one, you can needle the opposite side. So again, if you've got that access to those handouts, this is in that handout, and this is the first system that's on that one. So system 2, this was probably the one that I struggled with to try and get my head around what he was actually talking about. So I'll spend a bit more time on that one. Is what he terms a branching system. So hand channels balance foot channels. Yin balances yang, so again, that sort of makes sense. You'd have a yin balancing a yang and a hand balancing a foot. So I'm like, okay, I can get my head around that. And it sort of took me back to when I was discovering a bit about Chinese medicine. And those first time you hear those Tai Yin, Tai Yang names, Shao Yang, Shao Yin names, and you think, well, why doesn't the Tai Yin balance the Tai Yang? And why doesn't the Shao Yin balance the Shao Yang? In this system, they do. So we end up with the Tai Yins treating each other, or sorry, the Tai Yin treating the Tai Yang, the Shao Yang treating the Shao Yin, and then we're left with the Shui Yin treating a Yang Ming channel. And for this one, we needled the either side. So again, we can palpate for that Asher point for that. So again, this sort of took me a little bit to get my head around. So I went searching for something a little bit better that could explain it, and I found this picture from the Jason Robertson and Wang Juyi text, where it talks about, sorry, that's my picture doesn't really come out terribly well, but the Tai Yang is open to the exterior, and the Tai Yin is sort of open to the Yang Ming or the Yang area. And then we have these two pivots in the center. We've got a Shao Yang pivot on the outside and a Shao Yin pivot on the inside. So, and then we're ending up with a Shui Yin and a Yang Ming. So again, we've got our Tai Yangs here, we've got the Shao Yins on the other side, and then the Yang Ming and the Shui Yin. So probably the clearest example of using this practically is pericardium 6. Again, if you've ever thought of using pericardium 6 for a nausea, essentially you've used a Shui Yin point to treat a Yang Ming problem in this sense, because nausea involving the stomach, it's a Yang Ming organ. And then, is it such a stretch to say that you've done it as well and gone, I've used a hand Yang Ming point to treat a foot Shui Yin problem? So again, the clearest example that I could find for that was colon 4 to help move the liver qi, which I'm sure that's something that we've all done. So I'm like, okay, yep, I got my head around this. I hope this sort of makes a bit more sense for you guys as well, those first two systems. So then system 3 is something that we're probably all over quite frequently, but it's our yin-yang partners, our interior-exterior relationship. So, lung balancing large intestine, spleen balancing stomach. I'm sure I don't need to go into any more detail for that, but I'm sure you get your head around that one. So with this, the yin balances the yang, and the right-hand side balances the left-hand side. So to needle it practically, we pick the opposite side. Okay, so the first three systems, they seem pretty easy. Then getting your head around this was, well, for me, was quite easy, with the system 4 being the Chinese clock. It just took me a little bit of time to remember it. But what we're actually after with system 4 is the opposite side of the meridian, or sorry, the opposite side of the clock. And he also said that you don't really have much time on you don't need to needle the patient in a certain time of day if you're treating a heart problem or a bladder problem or anything along those lines. So pick the opposite meridian of the clock. Hand treats foot, yin treats yang, and several pairs line up with system 2 as well. So the lung lines up with the bladder, and the pericardium lines up with the stomach, and the heart lines up with the gallbladder again. So what that means is those three pairings is quite a strong pairing together, or quite a strong balance between the two. And again, either side can be needled with that one. So from this, then we've got our wonderful clock picture here. So I'm sure we've all got that diagram when we were studying as well. So again, it's easier to draw it as a clock than, and see what's actually opposite and go, okay, we've got a lung here, the bladder's opposite. We've got large intestine here, the kidney's opposite. This is probably a system that Dr. Tan uses a lot. This liver to small intestine. He reckons this is a very, very strong bond and a very, very strongly effective way of treating particularly scapular problems, or where that small intestine channel goes across the back. He uses a lot of liver channel points to treat that. And his reasoning is, the scapula is a bone, and where he puts his liver channel is on the bone. Like, he puts the liver channel starting basically from the top of the tibia and needling like across the whole fiber of the bone. So it's, again, certainly not a WHO location, but he finds it particularly effective. So again, this is just showing that that particular system. So system 5 is the clock neighbors. So essentially pairing meridians that are adjacent to each other. Hand and foot are paired together. Yin channels are paired with yin, and yang channels are paired with yang. So we end up with the same polarity. And again, some systems overlap with system 1. So our system 1 being our Tai-Yang divisions, or sorry, our 6 divisions. And with this one, our opposite side is needled. So again, that's fine, but they're paired like this. And probably the easiest way to start is with the lung and the liver, and then just go to the next one round, and the next one round, next one round, next one round. So, then we've got a yin-yang pair here. Sorry, we've got a 6 divisional pair here, a 6 divisional pair here, and a 6 divisional pair here. So I hope that sort of makes sense as to what the first 5 systems are in Dr. Tan's balancing approach. So again, you're going to have access to these slides as well, and you can go over these, make notes, and have a look at the handouts. But that's basically the systems that we're talking about. So I did say 6. The last system is something that we use very often. It's using the same channel to balance the same channel. So it's using that whole reflexive action of the channel to balance itself. How we often use bladder 40 to treat lower back pain, or bladder 60 for the neck pain. And again, either side can be needled, with the exception of if the pain is on the limb at that particular area, then you'd use the opposite side. So if you're using it to reflect the whole channel and it's not actually affected, then you can palpate either side. But if the problem is that area, you needle the other one. So I hope that makes sense for you. So again, common bladder 40 there. So this is our table. So this is the handouts that you have. Not going to spend too much time on that because we've just explained that. So hopefully that makes a little bit of sense for you, and explaining my crazy chicken scratchings as well of diagrams that are on that one. So then there's the concept of mirroring and imaging. So mirror, he said we use it for limbs. So this is the mapping of one limb to another. So again, an arm to a leg to an arm, etc. Look for your homologous structures. So look for the structures that are the same. So the hip sort of looks like the shoulder, and the ankle sort of looks like the wrist. So they're a decent mirror of each other. And it's quite remarkable that the body's ability to reflect the tenderness and weakness and tightness that can correlate to the problem in there. So then we pick that, we pick a balancing meridian, and then mirror the anatomical location of the chosen meridian and palpate for Archer points. So again, if we're talking an elbow, like a lateral elbow problem, we pick the stomach channel on the other side, okay? And again, mirror balances upper with lower, with the exception of of system 3 when we're talking yin-yangs, where right and left is balanced. So again, we've got our lovely diagram here of showing our mirroring systems. So one shows a normal mirroring and the other one shows a reverse mirror. And this is probably the concept that people struggle with, of when to use one and when to use another. And palpate, see what happens. And also if you think, okay, someone's got a shoulder problem, me going to their hip, that mightn't be always practical. You've got another option. So you can go to their ankle. Whereas imaging is a relationship between the limb and the whole body. So common ways of doing this, if we look at those handouts, is the hand or the foot is the head, and the limb itself is the torso or the trunk, depending on what terminology you want to use. And again, different parts of the limb represent different parts of the body. So like the wrist might be the neck, and then a little bit further down might be the chest, and just progressively go further down from there, with the elbow being the waist. So again, we're just explaining those diagrams there, saying the elbow and the foot and the head, etc. The navel being the shoulder or the groin. So it's just the idea of the whole microsystem that can treat the macro system, common in auricular acupuncture. And again, just to complicate things can be reversed as well. So again, this is the other diagram showing those reflexive actions, which I'm sure you can go through in your own time. You don't need me to walk you through that, but basically things are reflexive. Then another one that he used is this one. He used this particularly for head and facial problems. Rather than using a smaller microsystem, this gives you a larger surface area to deal with. So particularly if you're dealing with Bell's palsy or facial paralysis or something like that, if you're working on a smaller canvas, so say if your microsystem is only the head, you're using the balancing one of either the hand or the foot, trying to map exactly this, you just don't have the you're just not as precise if you expand the canvas out, and then you can actually trace for what things are. So he uses a lot of knee points for eye problems, and mouth sort of around the spleen 6-ish area as well. And again, this is another one that he uses, and this one is particularly for his scalp balancing. So this is how he balances the Do channel. So this is the head with the hairline. Imagine someone laying over the back of your head. The sideburns are their arms. The tailbone is the occipital protuberance, and the legs come down through here to the hairline. So again, we can sort of see from here. So this is drawing by him. So what's this actually leave you with? It leaves you with most of the points affecting the whole body, from the fingers to the elbows and the toes to the knees. So we're back to, again, an element of truth, where the vast majority of points that we use go from the fingers to the elbows and from the knees to the feet. So again, it's just a different way of looking at it. So when needling, he had a couple of rules. If the pain or the problem is a point, you pick a point. If the pain is a line, you pick a line. So you put several needles in a line following the meridian or the channel or the area. If it's an area, pick an area. If the problem is at the skin level, needle to the skin level. Problems at the muscle, needle to the muscle level. The problems at the bone, needle to the bone, which I'm sure is not really a new concept to you. But again, his version is you don't do it locally, you do it on one of the balancing channels from those systems. This is probably the big one that you'll see a lot. It doesn't actually occur on the meridian, it occurs between the meridians. So the important thing is to needle between the meridians, find the Ashur points in between the meridians. So a common one that you'll see a lot is like a tennis elbow that doesn't happen exactly at large intestine 11 or exactly on the Sanjiao channel. So it often occurs between the two of them. So therefore you'd pick balancing meridians in between there, if that makes sense for you. Okay, so if we check in, how are we going with that? Does that, I know I've skipped over that, but does that make sense for you guys? You can type in, raise your hand if you've got any questions in through there. Yep, so far so good, all good, excellent. How's everyone else going? Sweet, awesome. Looks like everyone's all over that. So then what we're after next, does anyone have any questions? Want to unmute anyone, or that all sort of makes sense? So far so good. We'll need to revise, yep. Okay, cool. So we'll move on to a bit more of the fun stuff. So, the TAN, or the matrix, again, we're not talking about the Keanu one, but we could do. All I'm presenting to you is the truth. It's your choice to pick the blue pill or the red pill. So again, if we take the blue pill, we wake up tomorrow, everything's all good, forget what's even happened, or we take the red pill and I show you how deep the rabbit hole goes. So I'm voting red pill. Let's say we've got a patient that's got this sort of problem, where we've got lots of, either neck referral or upper traps causing these problems, but essentially the pain or the channels or the problem goes over a vast area and a vast number of channels in there. So rather than needle every single Hawado point, every single motor point, I just did a very quick count, and to needle all of those points in through that neck without really getting too far, we could needle 25, 30 points quite easily. And that may get there, it may not, but it also, we probably don't need to needle 20 or 30 points on the patient if there's an easier way of doing it. So his way of looking at things is, how can I have the greatest reach and treat the most meridians with the fewest points possible? Make sense? Okay, yeah. So not uncommon to have this sort of patient, and this is, Dr. Tan's quite a cheeky guy, and he's saying like this is one of his $1 million combinations, and he was saying, no, I'm serious. You should be able to make $1 million over your career from just this one piece of information. If you see 20, 30 patients a week for X amount of years, yes, you will get to this $1 million. And he had several of these $1 million treatments. So rather than needing them all, we can use the matrix for it. So our questions are, what's the affected meridians? So our answer is the bladder channel, the small intestine channel, the Sanjiao, the gallbladder, and the large intestine. So basically everything apart from the stomach is involved in this pain. Well, every yang channel apart from the stomach is involved in this one. So, okay, how can we balance these meridians? So we've done our what meridians are affected, which is our step 1. What's our balancing treatment, which is step 2. So this is just straightly taken from that chart. So we've got our large intestine, our small intestine, bladder, Sanjiao or triple energizer, and gallbladder. And then we've ended up with just filling in the gaps of system 1, system 2, system 3, system 4, system 5, and system 6. So then we go, okay, what channel balances more than one? And we can certainly see that the kidney comes up. It balances the large intestine, it balances the bladder, and it balances the Sanjiao or triple energizer. So we're like, okay, the kidney might be involved in how we actually treat or approach this. We can also see that the liver balances the other two in this situation, so the small intestine and the gallbladder. But there's another way as well. The heart does as well. So both heart and kidney and liver and kidney will treat all of those meridians of that neck pain. So having actually received this treatment from Dr. Tan, it's quite incredible how quickly I didn't feel pain at all. As soon as the needles went in, the pain changed, and I've had a lot of neck pain and basically that whole pattern for a very long time. So I was like, okay, I'm really quite interested in this. And then, you know, how long does it last and all this sort of stuff, I'm sure are questions that you have. But again, how long is a piece of string, really? But you should be able to see a change instantly. Oop. So kidney balances bladder. This is, again, just what I said. Kidney balances bladder, Sanjiao, and large intestine. Heart and liver balance small intestine and gallbladder. This is actually the treatment of, I don't think that one's the Rod one. I think Rod got the heart and kidney, but there's a, this one's a liver and kidney. So when you actually get these slides, this one will go to a YouTube link. And again, this is Rod Hinks's treatment, getting the heart and the kidney needled for his neck pain. So this is the one I sent out in one of the registration forms. And yeah, it's actually quite effective. Very, very fast acting, that one. So he uses this matrix to develop strategies for multiple problems. The ones that he specifically told us about was Bell's palsy or facial paralysis, which is the photo that I've got up on the slide. So again, what meridians are involved, and then these are just the systems that balance it out, and then how can we see as many, you know, how can we treat as many with as few meridians as possible. So the affected meridians for Bell's palsy, basically all those channels apart from the bladder channel, not really affected in this sense. So the balancing meridians, again, just filling out that matrix, we end up with liver and spleen and liver and pericardium, balancing all of those channels. And he had a good one for shingles. Shingles only had the 4 channels, but we end up with a few different ways of actually getting that to balance with small intestine, Sanjiao, small intestine and heart, small intestine, liver, lung and Sanjiao, lung and heart, and lung and liver. Okay, so this is where it becomes even more, well, not freaky, but stretching that concept even further, where can we actually balance the whole body with as fewer meridians as possible? So his way of explaining this is talking about global balance, and I like to find this picture, you know, that had Australia on it and the Aurora Australis as well, because any other picture that I put in had America. So I was like, no, I want to find an Australian version. So why do we use this one? Basically, if the problem's systemic, so things like osteoarthritis, allergies, you know, sinus problems, all of these sorts of conditions that don't quite balance to, you know, the wrist treating the ankle, the knee treating the elbow, the shoulder treating the hip, etc. So enter the global balance pattern, where we can balance the 4 channels and balance the whole body, well, in Dr. Tan's point of view. So with this one, this is how we can set it up. The polarity can be reversed, it doesn't really matter, but basically as long as you have one arm that's yin and one arm that's yang, and one leg that's yin and one arm that's yang, and we end up with a cross pattern of these. So to balance this, we're looking for stable structures. So what's a stable structure, I hear you say? Dr. Tan comes from an engineering background. He has either he has his PhD in engineering or he was going to study his PhD. I'm not entirely sure, but you know, does come from an engineering background. Oop. So what's a stable structure? That's a stable structure. So the lines indicate where they balance. So the yin channels balance each other from the leg to the arm, and the arm channels balance each other from yin to yang, and the yang channels balance each other from arm to leg. So again, what other stable structures can we look for? We can look for a bow tie. So again, it's just the same thing, just turned on its side. Yin channels balancing each other, and yang and yin balancing each other from those systems. The square, so the square is a stable structure. Again, so this is our yin-yang pairs. So we'd have large intestine and lung on the top, and then another pair down the bottom that reflects that one, which would be most likely a Tai-Yang problem. But probably your most stable structure, if you talk to any engineer, is this. So we not only balance in one direction, but we imbalance, each meridian balances three other meridians effectively. So again, if you're thinking stable structures, they're your stable structures and how he actually looks at balancing these. Okay, so does that make sense, or have I lost anyone on that one, or does that sort of okay? Just raise a hand, type it in. Yep, all good, making sense. Sweet, sweet, excellent, cool, good to hear. Good to hear. So now we get into a bit more of the fun type of stuff of how do we actually treat stuff? How do we actually practically look at common conditions in a slightly different way? So let's say allergy, and for the sake of this, allergy and common cold is exactly the same way of looking at it because the same meridians get affected, okay? The vast majority of this is a Yang-Ming problem. So our Yang-Ming is our stomach and large intestine. Balancing a Yang-Ming through a global system, so using that table, coming up with your what treats the stomach channel and what treats the large intestine channel, writing them out, and then how can we hack that to come up with the least amount of meridians possible, and still end up with a stable structure. So we include our affected meridians in the treatment. So for this one, we'll include our large intestine and stomach. And they can be balanced, I'll save you the work. They can be balanced by the Tai-Yin or the Zhui-Yin or a pericardium and kidney. So if we're treating a common cold, which of those do you think is more common that we'd want to pick for the common cold? Tai-Yin, right? The lung and the spleen. Most likely we'd balance it by a Tai-Yin to a Yang-Ming approach. So that looks like this. So again, we've got our stable structure, got our nice happy looking little dude. I've ended up with the 4 channels. So this Tai-Yin Yang-Ming one is particularly good for any problems that run through the center of the body. So in Dr. Tan's point of view, or if we look at this could be chest pain, reflux, nausea, uterus, but not ovaries, and bladder. So basically, if you think, okay, if we go from our abdomen, basically the width of your hand all the way up is affected by those 4 channels, okay? So he said that all these central problems involve the same channels, they just have different points and different reflexive actions for it. So if we diagnose the sick meridians, so the Ren, again, central, yes, definitely Ren. Kidney, just a little bit off center, and stomach channels a little bit further off center as well. And still, that edge of where you put your hand if we did it through the center of the body. So then step 2, we balance it. We include our affected meridians. So we definitely said that kidney was involved, and we definitely said that stomach was involved. The Ren channel, he used the scalp to balance it. So this is how he balances the Do channel. Or you could do it on the Do channel on the back. At whatever level is the problem. So if we look at that from a diagram point of view, We've got our happy little dude again. We end up with our stomach and our kidney. And then what channels balance these ones? Again, I'll save you the work. But the pericardium and the large intestine. And we end up with our little bow tie type of structure on this one, where the kidney balances the pericardium and the large intestine, the stomach balancing the large intestine and the pericardium. So then how do we pick the points that are going to treat this particular patient, or these particular patients that have these particular problems? If we use images, these are the points that we use. So pericardium 5, pericardium 6, that would be about where the chest would be. If we looked at large intestine, it would be about large intestine 6, although he said that large intestine 3 works particularly better for this one because he's using the whole metacarpal bone as another image where the head of the metacarpal bone is the head and then the bottom is the feet, basically. Stomach 40, so again, this is just straightly reflective. He talks about stomach 40.5, so meaning an Asher point somewhere between stomach 40 and stomach 41, usually about halfway, would reflect the chest. And he said kidney 1 particularly good because kidney 1 is, again, using the whole sort of foot as a microsystem. We're in the dead center of that, and particularly good for chest problems. So this is how he comes up with his point prescriptions. For stomach problems, diagnosis is still the same. Stomach 36 treats the stomach, as we all know. Pericardium 3, so again, he's just reflecting pericardium 3. Anywhere where I've got 3.5 or this sort of stuff, between 9 and 10, again, we're just looking for the Asher points in between these 2 points. And kidney 9, again, looking for the Asher. Umbilical points, like an umbilical problem, hard around the umbilicus, or borborygmus, or one of those sorts of small intestine type of problems. He goes for these type of points. Stomach 35, kidney 10, large intestine 11, pericardium 3, and again, you can look for a couple of points in the area, particularly if the problem itself has a larger surface area than is just a specific point. And again, if it's lower down, uterus and the bladder, then we're using a reverse image, and we end up with many of the same sort of points that we've already picked. So pericardium 6, kidney 7 or 8, stomach 40, and large intestine 6. But then he went on to say that clinically, he's also found these ones work particularly well more for uterus problems. So large intestine 4.5, or as anyone that's looked at some Master Tung stuff, it's Ling Gu. So Ling Gu is basically at the base of the first and second metacarpal bones, in between the thumb and the first one, right at the base of that one, that spot. The hand uterus point, so anyone that's looked at the hand microsystem, this is where the uterus actually sits. So it's just up from where pericardium 7 is. And again, if you divide pericardium 7 to 8, you end up with pericardium 7.2. That's where he's talking about for this uterus point. Spleen 6, yes, definitely, because I'm sure we've all used spleen 6 to treat uterus problems. Kidney 7 to 8, again, I'm sure we've probably used that as well. And stomach 40, again, because it's the reflexive action, the image of where the uterus would be. So again, then we end up with a nice, lovely little balance. And even though large intestine 4 and the hand uterus point are not specific points, they're still definitely on that channel. And that's something that Dr. Tan really emphasizes is, treat the channel, treat the channel, treat the channel, not the specific point. Another concept that he went on for was looking for the most stable structure. So I've already said before that most stable structure is that square with the 2 bridging in between it, or the cross bridges in between it. So he's like, yeah, I found that. That's okay. How many points do I need to do it? I can nearly do it with 8, right? I can do it all the time with 8, and if you actually go through and track out what actually balances what, you nearly end up with 2 effective stable structures in there, like a double one from the top, and then a double one from the bottom, and then a double stable structure. The only one that doesn't balance is the gallbladder and lung, doesn't end up doubly balanced. So he threw in heart 5 to balance this one. And what he treats this particular one, this one's referred to as his magic 8+1 point, because he had it and then he just added the extra +1 point to come up with like this perfect balancing, double system. And he uses this one to treat a lot of digestive problems, any sort of digestive problems at all. This is like his shotgun approach to anything digestive. So again, we've got a nice, lovely little pretty, everything's balanced, but everything's doubly balanced on this one, with particularly these ones. So we can do this for a lot of different channels. The next one that we can balance like this is the Xiao-Yang. So again, if we include our Xiao-Yang points, Sanjiao/gallbladder, this balances like this with the pericardium and the liver. So again, we end up with our hourglass. Different way of doing it, Sanjiao, gallbladder, heart and kidney. So again, depending on, if someone came in with more, like there's a Xiao-Yang problem, but the liver's involved, then you pick the liver and the pericardium. If the kidney and the heart is involved and they can't sleep particularly well, you pick the kidney and the heart in this sense. So this ends up with a bow tie, and then the next one, if they have more digestive problems, or if they have, heart chi, what we'd call heart chi and spleen blood deficiency, or sorry, spleen chi and heart blood deficiency, add in the heart and the spleen. So depending on how they present determines which one you can actually use to balance it. We can do the same with Taiyang. So small intestine and bladder, heart and kidney, also can be balanced by the lung and the spleen, more with that bow tie, and with the liver and the lung, again with that bow tie type of approach. And I know what you're thinking, but where do I start? Do I start on an arm? Do I start on a leg? Do I, what do I needle first? Do I need to do it in a cross pattern? Do I need to do anything like this? And again, Dr. Tan says it pretty well. He's like, okay, so Vincent van Gogh painted this picture, Starry Night. Did he start with the trees? Did he start with the stars? Did he start with the swirls in the sky? Or did he start with the moon? Does it matter? No. The fact is that he ended up with Starry Night. Okay, so it's more like, where do you end up? And his whole thing is, don't get stuck by the rules, and it has to be done on the left-hand side and then the right-hand side and all of this sort of stuff. Just end up with the result. Okay, does that make sense? Checking in again? I know that's probably covered a fair amount of information. Yep, just type them in, or if you want to raise your hand. Nominally makes sense? Yep. Again, I know I've skipped over this, but again, it's still just concepts of it. Yeah, we'd love to review the slides. Yep, you can get the slides easy. Another way that he looked at when we move on to another type of way of treating is a hormone problem. So again, granted, we're going to see a lot of women with particularly hormone problems of any description. So this can range from irregular bleeding, bloating, distension, water retention, edema, weight gain, sweating, more in terms of menopause, forgetfulness or absent-mindedness, cramps, abdominal bloating, or clots during a period, emotional problems. And his big thing with this was, okay, so what's involved in all of these ones? And he said to start with the spleen. which I'm like, okay, yep, I get that. It'd probably be my point, that I'd be looking for. I'd be looking for the spleens for this, and then work a treatment in and around that. So his treatment for anything gynecological, he said to use the spleen. So then what systems or what meridians balance the spleen? The heart. The Sanjiao's included more for the fluid metabolism, and the gallbladder's included because the gallbladder and the heart particularly involved in the Shen. So again, we ended up with our lovely little bow tie, everything balancing from these ones. So spleen, he said, particularly great for hormones. Heart, gallbladder, Shen, and Sanjiao helps the spleen with the water metabolism. So I'm like, great. I'm sort of on the right track of how I approach a lot of gynae problems as well. Move the liver chi, settle the heart. Okay, I wasn't probably all that, using Sanjiao, but okay, I've got 3 of them, or 3 of the points that I would pick, or 3 channels that I pick that he picks. So I'm like, okay, 3 out of 4 is not so bad. But then he sort of took it to a bit more of a whole nother level, where, so Dr. Tan's treatment for anything gynae, spleen 4, spleen 6, spleen 9, Sanjiao 5, heart 5, gallbladder 41. So with, pretty much the exception of Sanjiao 5, I was using those points from many gynae problems. I'm like, okay. So then when we put Sanjiao 5 in, then we start getting this balancing treatment. Then he combines it with the treatment that we just saw for anything uterus related. So there's Linku, pericardium 6 and 7.2, stomach 36. So he says look for stomach 36 usher, and stomach 40.5 look for the usher. Kidney 7 look for the usher, and he adds in this Yang Ming / Zhui Yin balance on top of that. So we end up with, this is the diagram that he drew of this particularly unhappy gynae patient. And he reckons this pericardium 7.2 particularly effective, anything uterus related, any uterine cramps and that sort of stuff. Linku, particularly good at anything to do with pain. Stomach 36, so we're looking for stomach 36 mainly because this is from an imaging point of view, and stomach 40, where the uterus would sit if we imaged the whole lower leg. His treatment, so I'm like, okay, I'll try that. So I think that's quite a good, actually well-balanced treatment. And I've definitely tried this uterus point on the hand and actually got some really good results for patients from that as well. So suggest that you do the same on that one. And form your own opinion on that one. He came up with another treatment on heat. So this was how to deal with fevers, be it low-grade heat, high-grade heat, all that sort of stuff. So the points that he picked for this, the channels that he picked, he said particularly the small intestine is involved because we've got a yang channel, a yang aspect on a hot, and its element is heat. So I'm like, okay, that makes sense. How do we balance the small intestine? We can balance it this way with heart. We know that the heart's certainly involved in heat, again being a fire element. The liver particularly involved in heat, particularly when it gets stuck. And the gallbladder, taking that excess heat out of the liver through that. So I'm like, okay, this makes sense. It's, it's all quite logical. And the points that he picked for this one are the Shoestream and the Hersey points on those ones. And this is from a Bagua, which I haven't done the Bagua system, but looking at just from that, the Shoestream points and the Hersey points definitely clear heat in this sense. So, but the Bagua is way more complicated, where he looks at all of these ones having individual trigrams, and then you're trying to get a certain trigram out of the whole thing. So it's a little bit more complex, but we're not going to go into that one today. So this is another balancing structure. Again, we've got that square. This was his other, he came up with another treatment for global balance for the back. So what he suggested, this one, it's not just pain from L1 to S1, but if they've got other complications, so they might have digestive problems, they might have palpitations, they might have you know, some sort of mental, emotional type of component to it. So it's not just specifically just for back pain. So he said it doesn't really work for the sacrum or the sacroiliac joints. The best way for sacral stuff is to actually image the scapula. So particularly, you know, if it's the sacroiliac joint around sort of that small intestine 14 type of area. If it's pain is lateral, then through all those, you know, rotator cuff muscles through the scapula. And if it's lateral again, then go lateral. So he modified this by adding in a Xiao Yang balance on top of it. So particularly what he's chosen for this one is lung 5 to lung 6. So as we've seen in those systems, the lung channel specifically balances the bladder channel. Heart, in this sense, more balances the gallbladder. So if we're talking, you know, lower back, we've already balanced the bladder and we've balanced the gallbladder by needling these points here. So heart 3 is, or heart 3 and lung 5, that whole crease is the belly button. So basically we're just trying to mirror down and look for the Archer points on these channels. Bladder 65. So again, bladder 65, that whole idea of treating the channel to treat the channel. So that's the shoestring point. The shoestring point of the gallbladder as well. The kidney balances the well, it also balances the lung and the heart as well. And then he adds his version of liver 8. So his version of liver 8, if you feel down on yourself where you normally put your normal liver 8, and what you've got is, you know, a pretty decent depression, but he puts all his liver channel points actually on the bone itself. So if we come way over past where spleen 9 is and actually onto the surface of the tibia at about the same level, I feel this lovely, nice big depression there, and it's actually quite tender on me, and that's where he puts his liver 8. And he needles basically from the top of the crest down the whole tibia, or down that whole surface for that whole liver channel. And another point that he has that's slightly modified is his version of gallbladder 34. So again, if you feel where your normal gallbladder 34 is, where you go anterior and inferior to the head of the fibula, he just goes straight inferior. So he goes actually into the tendon and he actually touches the bone. So I've tried this one, and you get a much stronger reaction when you needle it there than the anterior inferior gallbladder 34. So is it gallbladder 34, or is it a different gallbladder 34, or is it a different point? Who knows? But that's what Dr. Tan calls his version of gallbladder 34. And for those of you that are a little bit worried about that, going, oh, I know there's a nerve in and around there, the nerve's behind the bone. So we're not going into that nerve at all. Then what he also does is this Linku and Sanjiao 3.5 as well. So what we end up with is 8 channels, and we get that structure from the first one, and then we end up with the bow tie as well. So we end up with that very stable structure. So this is his quite broad approach to treating a lot of lower back pain that involves particularly the bladder and the gallbladder, plus with other complications that we've alluded to. Probably the two sort of quick cheap wins that I got out of this one was his quick and dirty anything lower back pain and quick and dirty anything neck. He has a particularly awesome way with words. So if the pain, let's say it's on the left-hand side, we pick the right hand and we thread needles that start from small intestine 4 and they go through effectively Sanjiao 3.5. Which effectively is sort of more one of the Yaotong shuis. So those of you that have done any of those hand microsystems know where those Yaotong shuis are, in between the 4th and 5th and the 2nd and 3rd metacarpal bones. He says that whole area is the lower back and that whole area is the Yaotong shui. So we go from one side and then from the other side, so the Linggu is where the thumb is as well, with 2 needles. And we end up with, I can't go back to it, but I think it was about the 3rd or 4th slide where I told you that woman was getting back pain. That was his, this version of it. And the theory behind this one, he's using that whole metacarpal bone to image the whole body for it. So that's where the lower back actually sits when we image the body that way. Again, if we're doing any sort of threading stuff, we want to be needling slowly. So insert the needles, wait a couple of seconds, and then go in, so that the body's sort of more accepting of the needle and it doesn't hurt. All the things that you tell your students to when you're teaching them how to needle. Then what he also suggests is these points as well. Same side as the pain. The lung, from lung 5 to lung 6, and having people in the clinic as well with acute back pain. This lung 5 to lung 6, I'm sure works particularly well, particularly when it's a bladder channel that's actually involved. It doesn't work so well if it's the do or on the spine. And then the heart, particularly if the gallbladder channel is actually involved. But if the pain's actually on the spine, he said you can either use the lower Ren points, so from like 2 to 6, or that scalp image that's included there. So having used a few of these points, particularly good for lower back pain. Used them on a few patients in the clinic. So then his quick and dirty neck pain was something that I'd sort of thought of, where again, we're going through that opposite hand and we're like, okay, yep, we've got that Lao Zhen. And sometimes when you needle Lao Zhen, it works and sometimes it doesn't. And he said the reason why it doesn't is that you haven't actually balanced all the meridians of the neck from just needling the Lao Zhen. So his way to actually do that is very similar to what we've done with the lower back, but you start with a point called Da Bai, which is large intestine 3-ish. It's just slightly off where large intestine 3 is. It's like if you go where your normal large intestine 3 is, and you come up over that tendon, like, we're only talking like, I don't know, 2 or 3 mil, if that. And then threading that through to Lao Zhen, and then threading small intestine 3 through Sanjiao 3. So then we end up with 2 points or 2 needles threading through. Again, if you can do it with 1 needle, you can go for it, but most people can't really do that with just the 1 needle. And then he talks about this other point, this Sojin. So Sojin is in between the middle finger and the ring finger in that same location at the top of those metacarpal bones. So end up with 3 needles, and what you actually do is from those 3 needles you're actually balancing all the 6 channels, or the 6 yang channels that go to the neck. So Yang Ming, Xiao Yang, and Tai Yang channels of the neck, and again we've had some pretty great success with stiff necks from doing that one, whereas in certainly in my experience the Lao Zhen does back up what he's been saying. Like sometimes it works and sometimes it doesn't, but this approach covers all the channels that are involved in the neck. And again, like most of his treatments, we move the area while the needles are in and retain the needles for about 30 minutes. Okay, so that's all my slides that I'm going to present today. So do you have any questions for that I can possibly answer? Or have I lost you, or are you with me, or? Might be a simple question, but how does Dr. Tan identify which meridians are sick? Basically through where the problem is. So if the problem is on where the large intestine channel goes, then that's the problem meridian. Does that make sense, Tom? Yeah, channel pathway, yeah. So he's more just taking the external channel pathways. What gauge needles? He uses usually 0.25s to sometimes he occasionally uses 0.30s depending on where he's needling, and usually gets fairly strong chi on them. Yeah, so another question is, so spleen, why was the first choice for spleen? Several meridians certainly could be considered, kidney, liver. Yeah, definitely he goes for those as well, but he said probably because the spleen is involved in all of those pathologies, that's why he picks the spleen first. But yeah, definitely he does certainly use the kidney channels. He doesn't, well, from what I saw, he didn't tend to use the liver channel too much for gynae, more because he's also balancing it at spleen 6. So yes, he is using the liver channel, but not indirectly, if that makes sense. Did he have a view on the 8 extras? He said no, he doesn't. Well, he does have a view on it, I'm sure, but he said that he doesn't use them as the 8 extras, but a lot of his points do use the 8 extra points, but he's not using them as an 8 extra treatment. Okay. Cool. Do we have any other questions? Okay, just need a last set of points for the neck pain. Yeah, getting relief with the 0.3 Hoata. Yeah, they're very good, very effective points for it. Very strong. Yes, very strong. I've been sitting at my desk occasionally and had those points needled in, and yeah, the hand sort of feels a little bit like it's on fire. But yes, they're quite strong. Needle retention time, sometimes between 30 to 40 minutes, and he usually doesn't manipulate them while they're in. Cautions, contraindications for his system, strong points for the neck, elderly, deficient. Again, using fairly, best judgment, but he certainly doesn't see if we look at classical terminology, the term, deficient is very, very weak, very, very, very deficient patients. Certainly not what we might term deficient in the West 2,000 years from now. Elderly, with the elderly patients, he treats a lot of elderly patients. He didn't have a contraindication or a caution, but probably don't go to town and from his system, you don't need to use a lot of needles. So I guess that's probably a caution, that he's negating by sheer virtue of his system. double checking on the 8 magic points if it was meant to be spleen 6 or spleen 9. Just one sec, I'll just go back to it. Where did I see that? Sorry. No, I think it was, somewhere. I have to do it this way. Yep, spleen 6. Okay, cool. Any other questions that you have that I can hopefully try and answer? All good? Excellent. So yeah, it's just again a different way of looking at things. It really made sense for me, being my quite logical Virgo mind. It's very logic based in the way that he approaches things. And I know I've covered a lot of information, and this seminar was actually done over 4 days, and I've pretty much crammed at least the vast majority of the nuggets into an hour and a bit. So I know if you're thinking, oh God, that's so much information. Again, you're gonna have access to these slides, you're gonna have access to the recordings, go over them, start practicing it, start using it, getting your head around it. Like most things, takes a little bit of time. But again, it's just a different way of looking at things. Okay, so cool. Excellent. So I hope you've enjoyed the Dr. Tan balance system, and hopefully, because we're going to start teaching this. So effectively, those that we're going to be giving the therapeutics lecture, and to a degree, some of it in the musculoskeletal subject, are going to be using this one. And I know it's also included in the CMAC 421, the advanced clinical workshop. So ideally we want to get as many supervisors up on this as well so that the students can actually practice this in clinic. So hopefully you found that interesting, and I will send out the slides and I'll let you know when the recording is available, and hopefully it comes through and it worked, and I know I've definitely pushed the start recording button, so hopefully you'll get access to that. But yeah, even starting with just system 1 or just system 2, and then getting your head around it and treating it that way, and then going, okay, I understand that. Yep, this sort of works. Yeah, I'm not so all over this one. This one doesn't work for me. This one doesn't settle for me. But yeah, definitely start practicing and start using it as best you can. And for those of you that want to take the next steps, which for me would be either buy or have a look at the books. We've only got a couple on campus at the Gold Coast at the moment, but I know Helio has those books. And also, if you want to get in on a Dr. Tan seminar, again, I don't know when he's going to be coming around, but I think he's probably going to be coming around and doing an advanced track, which is basically a lot of that information that we did today, in I think maybe January or February next year, and he's going to be doing the advanced one further down that, I think maybe in about October next year, and I think he's probably going to be in Sydney. So it's well worth I'll certainly keep you informed as to when that's actually going to happen. And the advanced stuff covers like seasonal balancing, I Ching, Bagua, a little bit more complicated stuff. So yeah, hopefully that makes sense for you guys. But and they're usually about 4 days each. So hopefully that's all good, and you've got some information out of this one, and hopefully that hand is settling down and that neck is settling down for the one that needled those points there. Okay, I'll see you guys later, and bye for now.